Chapter 7, Medicaid and Other State Programs. The objectives for lesson Medicaid and Other State Programs are 1. Explain what the Medicaid program is. 2. Discuss the history of Medicaid. 3. Describe added benefits for Medicaid recipients afforded by the Patient Protection and Affordable Care Act and the Health Care and Education Reconciliation Act of 2010. 4. Discuss the different types of Medicaid programs. 5. Discuss how Medicaid is administered by state government. 6. Identify those eligible for the Medicaid Qualified Medicare Beneficiaries Program. 7. Name and describe the 2 Medicaid eligibility classifications. 8. Discuss a healthcare organization's responsibility as a participant in the Medicaid program. 9. List valuable information to abstract from the patient's Medicaid card. 10. Describe the Medicaid basic benefits. 11. Explain basic operations of a Medicaid managed care system. 12. Explain basic Medicaid claim procedure guidelines. 13. File claims for patients who have Medicaid and other coverage. 14. Interpret and post a remittance advice. 15. Describe filing an appeal for a Medicaid case. And 16. Explain the purpose of the Medicaid Fraud Control Unit. History. Federal participation in providing medical care to the needy persons began between 1933 and 1935, when the Federal Emergency Relief Administration made funds available to pay the medical expenses of the needy and unemployed. The Social Security Act of 1935 created the public assistance programs. Although no special provision was made for medical insurance, the federal government paid a share of the monthly income assistance payments, which the individual could use to meet the costs of medical care. After the various attempts during the previous 30 years to provide medical care to the needy, in 1965, Title 19 of the Social Security Act became federal law, and Medicaid legally became into being. Changes in Medicaid eligibility, allowing more people into the program, were made by many states after the passage of the Deficit Reduction Act of 1984 and the Child Health Assurance Program CHAP by the federal government. On July 1, 2006, as part of DEFRA, a federal law became effective requiring new applicants and current beneficiaries renewing their benefits to submit birth certificates, passports, or other documents to establish their legal right to benefits as U.S. citizens. Medicaid programs vary from state to state. Many have different names. For example, Medi-Cal is California's Medicaid healthcare program. New Jersey's Medicaid is New Jersey Family Care. The state of Arizona has the Arizona Health Care Cost Containment System as their Medicaid agency, which offers health care programs to serve their residents. The Patient Protection and Affordable Care Act and the Health Care and Education Reconciliation Act are discussed in more detail on the following slide. The Patient Affordable Care Act and the Health Care and Education Reconciliation Act was passed in 2010. It expands access to Medicaid for childless adults and non-elderly and non-pregnant individuals. Includes the preventive services and long-term care benefits, and additional funds were allocated for maternal and child services. Beginning in January 2014, Medicaid eligibility limits increased so that adults earning up to 138% of the federal poverty level are eligible. States were given the choice to expand, and as of 2014, 18 states are not expanding, 30 states are expanding, and 3 states are expanding but using an alternative to traditional expansion. Medicaid programs. Title 19 of the Social Security Act provides a program of medical assistance for certain low-income individuals and families, as well as primary or supplemental coverage for people with disabilities, and known as Medicaid in 49 states and Medi-Cal in California. Each state designs its own Medicaid program within federal guidelines. Arizona is the only state without a Medicaid program similar to those that exist in other states. Since 1982, Arizona has received federal funds under a demonstration waiver for an alternative medical assistance program for low-income persons called the Arizona Healthcare Cost Containment System. The Maternal and Child Health Program provides federal funds to states to enable them to provide access to quality maternal and child health services, reduce the incidence of preventable diseases and handicapping conditions among children, increase the number of low-income children receiving health assessments and follow-up diagnostic and treatment services, provide prenatal, delivery, and postpartum care for low-income children, and increase in childhood immunizations. Provide preventative and primary care services for low-income children. Provide rehabilitation services for the blind and disabled younger than 16 years of age. Provide, promote, and develop family-centered, community-based, coordinated care for children with special health care needs. Low-income Medicare recipients. The QUIMBY's, the Medicaid Qualified Medicare Beneficiary Program, is for the elderly and disabled below the poverty line. They pay Medicare Part B premiums, deductibles, and copays. The SLIM-Bs, the Specified Low-Income Medicare Beneficiary, are the elderly who are 20% above the federal poverty line. SLIM-Bs pays the Part B premiums, and the patient pays Part B deductibles, copays, and non-covered items. The QIs, the qualifying individuals, whose income is at least 135% but less than 175% of the FPL. The QI pays the Medicare Part B premiums. Medicaid eligibility. The individuals who are eligible for Medicaid are the elderly, 65 and older, blind, disabled, members with dependent children with minimal support, low income or resources, or a U.S. citizen or a qualified immigrant. Categorically needy is aged, blind, or disabled individuals or families and children who meet financial eligibility requirements. Medically needy are persons in need of financial assistance whose income and resources will not allow them to pay for the cost of medical care. The Spousal Impoverishment Protection Law was enacted in 1988, where Congress provisions to prevent spousal impoverishment, which refers to leaving the spouse who is still living at home in the community with little or no income or resources. Maternal and Child Health Program eligibility. Some conditions qualify a child for benefits under MCHP. All state laws include children who have some kind of handicap that require orthopedic treatment or plastic surgery. A few states have other conditions. Other items on the list are cystic fibrosis, epilepsy, hearing problems, mental retardation, multiple handicaps, paralyzed muscles, rheumatic or congenital heart disease, and vision problems requiring surgery. Accepting Medicaid patients. A healthcare organization or provider must enroll for participation in the Medicaid program. The enrolling service provider must sign a written agreement with the fiscal agent as part of the application process. In the Medicaid program, a fiscal agent is an organization under contract to the state to process claims for the state Medicaid program. Identification card is a plastic or paper Medicaid identification card or coupon in some states, and it is usually issued monthly. Under certain classifications of eligibility, identification cards are issued in some states on the 1st and 15th of each month, every 2 months, every 3 months, or every 6 months. Sometimes an unborn child can be issued an identification card that is used for services promoting the life and health of the fetus. Obtain a photocopy and scan of the front and the back of the card. Point of service machine. The point of service machine connects to state systems to verify Medicaid coverage using information from a card. Retroactive eligibility is a patient who receives medical care while applying for Medicaid should be treated as a cash patient. Once Medicaid approves eligibility and sets a retroactive date for coverage, the patient should be reimbursed for any costs that will be billed to Medicaid. Medicaid benefits. Covered services are reimbursable services under the state's Medicaid program. They consist of a combination of the mandatory basic benefits and optional services that the state may offer. The benefits could include early and periodic screening, diagnosis, and treatment. Would also include inpatient hospital care and outpatient hospital care, any nursing facility services, home health services, laboratory and x-rays, family planning, and so on. Now, your disallowed services is that the physician can bill the patient in most states if a service is disallowed by Medicaid. Medicaid managed care. States have brought managed care to the Medicaid programs. Some states have adopted the capitation, which is a flat fee per patient rather than a fee-for-service reimbursement. In programs run for a number of years, it has been found that there is a better access to primary health care and savings of monies in the delivering the care if the programs are well managed. It helps control escalating healthcare costs, curb unnecessary emergency department visits, and emphasize in preventative care. Claim procedures. Copayments. There are two types of copayment requirements that may apply to a state. Some states require a small fixed copayment paid to the provider at the time of services are rendered. Another requirement is the share of costs or spend down copayment. Some Medicaid recipients must meet this copayment requirement each month before Medicaid benefits can be claimed. Prior approval is the evaluation of a provider's request for a specific good or service to determine the medical necessity and the appropriateness of the care requested for the patient. In some states, this may be referred to as prior authorization. Each state has its own time limit for the submission of a claim. The time limit can vary from 2 months to 12 or 18 months from the date that the service was rendered. A bill can be rejected if it is submitted after the time limit unless the state recognizes some valid justification. Most states have reciprocity for Medicaid patients who require medical care while out of state. Contact the Medicare fiscal intermediary in the patient's home state and ask for the appropriate forms. In the case was an emergency, state this on the form. File the papers with Medicaid in the patient's home state. Reimbursement will be at the state's rate. Because guidelines for completing the form vary among all Medicaid intermediaries, refer to the local Medicaid intermediary for their directions. When filing a claim for a Medicaid managed care patient, send the bill or claim form to the managed care organization, the MCO, and not to the Medicaid fiscal agent. The MCO receives payment for services rendered to eligible members via either the capitation or other managed care method. Each state's jurisdiction operates its own children's health insurance program with its own unique administrative characteristics. Thus, each has its own system and forms for billing and related procedures. The official plans and documents are retained in the individual state offices and are not available on either a regional or a national office basis. It is possible that a person can be eligible for Medicaid and also have group health insurance coverage through an employer. When Medicaid and a third-party payer cover the patient, Medicaid is always considered the payer of last resort. The third-party payer, other insurance, is billed first. After the remittance advice or check voucher is received from the primary carrier, Medicaid, the secondary carrier, is billed. A copy of the remittance advice or check voucher is enclosed. When a Medicaid patient has Medicare, sometimes referred to as a crossover case or dual eligible case, TRICARE or Veterans Health Administration, CHAMP VA coverage, always send the insurance claim first to the federal program fiscal agent servicing the region. Usually, the Medicare fiscal agent automatically forwards the claim to the secondary payer, Medicaid. If this does not occur, bill Medicaid second and attach to the claim form the remittance advice or check voucher. After claim submission, if a provider wants to receive an electronic remittance advice, a form must be completed and submitted to the fiscal agent. However, a provider that relies on the paper system is sent a remittance advice or a check voucher that accompanies all Medicaid payment checks. Sometimes five categories of adjudicated claims appear on a remittance advice, such as the adjustments, the approvals, denials, suspends, and audit/refund AR transactions, although this terminology may vary from one fiscal agent to another. Adjudication or claim settlement is the processing of an insurance claim through a series of edits for final determination of coverage or benefits for possible payment. Appeals is a time limit to file varies state to state, usually 30 to 90 days from the date listed on the remittance advice. The pathway of appeal is they go first to either the regional fiscal agent or the Medicaid Bureau, next to the Department of Social Welfare or Human Services, and then to an appellate court that evaluates the decisions by local and government agencies. At each level, an examiner looks at the case and makes a decision. And this concludes the lecture of Chapter 7, Medicaid and Other State Programs.